Homeo Guru. Please subscribe our channel. Press bell icon to get continuous updates. Exam oriented video part 6. Subarachnoid space. NSET. Option A L1, option B L2, option C L5, option D S2. Answer option D S2. It is the space between the arachnoid membrane and pia mater, filled with CSF. Complaints appear diagonally, upper left and lower right side. Option A sulfuric acid, option B lycopodium, option C agaricus, option D bromium. Answer option C agaricus. Complaints appear diagonally. Upper left and lower right medicines are agaricus, antium tart, stramonium, ledum. Upper right and lower left medicines ambragraceae, bromium, medorinum, phosphorus, sulfuric acid. Surfactant is secreted by option A type 1 pneumocytes, option B type 2 pneumocytes, option C bronchial goblet cells, option D endothelium of pulmonary vasculature. Answer option B type 2 pneumocytes. Surfactant is a phospholipid containing dipalmitoyl phosphatidyl Truck strength of sulfur. Option A 1 by 2, option B 1 by 20, option C 1 by 1000, option D 1 by 5000. Answer option D 1 by 5000. Truck strength of causticum 1 by 2. Cactus moschus 1 by 20. Buforana 1 by 1000. Introduction to sixth edition of Organon of Medicine was written by option A James Cross, option B Richard Hale, option C William Borick, option D Charles H. Devrient. Answer option A James Cross. Sixth edition of Organon of Medicine, edited by Richard Hale. English translated by William Borick. Commonest presentation of primary biliary cirrhosis. Option A pruritus, option B fever, option C pain, option D jaundice. Answer option A pruritus. Sensation of burning on vertex and smarting in eyes, in face without redness. Option A euphrasia, option B sanguinaria, option C sulfur, option D aconite. Answer option C sulfur. Heat of vertex medicines calcarea carb, graphitis and sulfur. Coldness of vertex veratrum sepia. Which of the following drug is supposed to prevent congenital neural tube defect? Option A thiamine, option B riboflavin, option C folic acid, option D pyridoxine. Answer option C folic acid. Folic acid is always known as vitamin B9. Source: green leafy vegetables, beans, peas and nuts. Absorption: small intestine. Deficiency: produce megaloblastic anemia, glossitis and chelosis. Falls asleep during evening fever and wakes when it stops. Option A muriatic acid, option B pyrogen, option C rustox, option D caladium. Answer option D caladium. Caladium. Its common name is American aura. Family Araceae family. Aversion to motion, very sensitive to noise. Pruritus vulva. All are branches of maxillary artery except option A anterior tympanic artery, Option B, posterior ethmoidal artery. Option C, middle meningeal artery. Option D, infraorbital artery. Answer option B, posterior ethmoidal artery. Maxillary artery is a branch of external carotid artery. It's a picture of maxillary artery branches. Vitamin B12 is absorbed in the option A, stomach, option B, duodenum, option C, ileum, option D, colon. Answer option C, ileum. Absorption of iron in duodenum and proximal jejunum. Absorption of calcium and folate in jejunum. Bile salt in terminal ileum. Most common site of myocardial infarction. Option A, anterior wall of left ventricle. Option B, posterior wall of left ventricle. Option C, posterior wall of right ventricle. Option D, inferior wall of left ventricle. Answer option A, anterior wall of left ventricle. Myocardial infarction. Most common cause of MI is acute coronary thrombosis. First sign of MI is rapid pulse. First symptom is dyspnea. Most common cause of death in MI, ventricular fibrillation. Most common artery involved, left anterior descending artery. ECG changes, ST elevation and T wave inversion. Postmortem finding in carbon monoxide poisoning. Option A, cherry red blood. Option B, intense cyanosis. Option C, excessive salivation. Option D, pinpoint pupil. Answer option A, cherry red blood. Carbon monoxide poison. It's a cardiac poison. Carbon monoxide affinity to myoglobin is about 40 times greater than oxygen. Carbon monoxide 200 to 300 times greater affinity for hemoglobin than oxygen. Diabetes control is best monitored by option A, serum glucose, option B, postprandial blood glucose, option C, HbA1c, option D, HbA2c. Answer option C, HbA1c. Criteria for diabetes mellitus, ppbs greater than 200 mg per dl, FBS greater than 126 mg per dl, HbA1c greater than 6.5%, 2-hour plasma glucose after oral glucose tolerance test greater than 200 mg per dl. First edition of Repertory of the Homoeopathic Materia Medica by Kent was published in option A 1897, option B 1979, option C 1974, option D 1910. Answer option A 1897. First edition 1897, second edition 1910, third edition 1924, fourth edition 1935, fifth edition 1945, sixth edition 1957, seventh edition 1974. Bochdolek hernia is occurs through option A, anteromedial part of diaphragm, option B, posterolateral part of diaphragm, option C, central tendon of diaphragm, option D, hiatus hernia. Answer option B, posterolateral part of diaphragm. Common name of Conium maculatum. Option A, poison ivy, option B, poison oak, option C, poison hemlock, option D, poison nut. Answer option C, poison hemlock. Common name of rustox, poison oak, Naxomica, poison nut, Vaithya, poison, weed. The rubric, slow healing of broken bones. In Repertory, seen in option A, extremity, option B, generalities, option C, skin, option D, sensation and complaints. Answer option B, generalities. In TPB, sensation and complaints, bones, healing of broken bones, slow. In BBCR, sensation and complaints, bones, fracture, slow union or formation of callus. Walks and stand unsteadily, especially when he thinks himself unobserved. Option A, argentum nitricum. Option B, muriaticum acidum. Option C, phosphoric acid. Option D, arnica. Answer option A, argentum nitricum. Patient trembles, leg weak, stumbles easily or make missteps. Answer phosphoric acid. Oozing of bloody fluid from navel of infants. Option A, calcareous. Option B, hyoscyamus. Option C, murex. Option D, hemamelis. Answer option A, calcareous. Oozing of urine, medicine is hyoscyamus. Thank you.